The immune system is the body's defense network, designed to protect against harmful invaders like bacteria and viruses. It consists of two main branches: innate and adaptive immunity. Innate immunity acts as the first line of defense, responding rapidly, but in a general way to a wide range of threats. In contrast, adaptive immunity takes longer to activate, but is highly specific, targeting particular pathogens with precision. Key players in innate immunity include cells like macrophages and neutrophils, while adaptive immunity relies on specialized cells such as T cells and B cells to recognize and remember specific invaders. The immune system is composed of several specialized cells, each playing a unique role in defending the body. T cells are crucial for identifying and destroying infected or abnormal cells, and they help coordinate the overall immune response. B cells are responsible for producing antibodies, which target and neutralize specific pathogens. Antigen-presenting cells, including dendritic cells, macrophages, and B cells, capture foreign substances and display fragments of these invaders on their surfaces. This process helps alert and activate other immune cells, ensuring a targeted and effective immune response. Major histocompatibility complex, or MHC, molecules play a crucial role in the immune system by helping the body distinguish between its own cells and foreign invaders. There are two main classes, MHC Class I and MHC Class II. MHC-1 molecules are found on nearly all nucleated cells and present fragments of proteins from within the cell to cytotoxic T cells, enabling the detection of infected or abnormal cells. In contrast, MHC-2 molecules are primarily located on specialized immune cells like macrophages, dendritic cells, and B cells, and they present external protein fragments to helper T cells, initiating a broader immune response. The distinct distribution and function of these molecules are essential for effective immune surveillance and the coordination of immune defenses. Immunoglobulins, also known as antibodies, are specialized proteins produced by the immune system to identify and neutralize foreign invaders like bacteria and viruses. There are 5 main classes: IgG, IgA, IgM, IgE, and IgD, each with distinct roles. IgG is the most abundant and provides long-term protection, often crossing the placenta to protect newborns. IgA is found in mucosal areas such as the gut and respiratory tract, playing a key role in defending against pathogens at these entry points. IgM is the first antibody produced in response to an infection, while IgE is involved in allergic reactions and defense against parasites. IgD, though less understood, is important for initiating immune responses. Understanding these classes is crucial for diagnosing and managing various immune-related conditions. Hypersensitivity reactions are exaggerated immune responses that can cause tissue damage and disease. They are classified into 4 main types based on their underlying immunological mechanisms. Type 1, or immediate hypersensitivity, involves IgE antibodies and is exemplified by allergic reactions such as hay fever and anaphylaxis. Type 2, or antibody-mediated hypersensitivity, occurs when antibodies target cells or tissues, as seen in hemolytic anemia. Type 3, or immune complex-mediated hypersensitivity, results from the deposition of antigen-antibody complexes, leading to conditions like serum sickness. Finally, Type 4, or delayed type hypersensitivity, is mediated by T cells and is observed in contact dermatitis and the tuberculin skin test. The complement system is a crucial part of the immune response, consisting of a series of proteins that work together to defend the body against infection. Its major functions include opsonization, which marks pathogens for destruction by immune cells, triggering inflammation to recruit additional immune components, and directly lysing, or breaking apart, invading cells. Central to these processes is the protein C3, which acts as a pivotal point in the activation of the complement cascade. The activation and cleavage of C3 amplify the immune response, ensuring that threats are efficiently recognized and eliminated. Through these coordinated actions, the complement system plays a vital role in maintaining the body's defense against disease. Cytokines are crucial signaling proteins that orchestrate the body's immune response. Among them, interleukins and TNF-alpha stand out for their significant roles in regulating inflammation and cell communication. Interleukins, such as IL-1, IL-2, and IL-6, help coordinate the activities of white blood cells, while TNF-alpha is a key mediator of systemic inflammation. These molecules are not only vital for defending against infections, but are also implicated in clinical syndromes like autoimmune diseases and sepsis. Understanding their functions is essential for recognizing their impact on both health and disease. Immunodeficiency disorders occur when the immune system's ability to fight infections is compromised. These conditions are broadly classified into primary and secondary types. Primary immunodeficiencies, such as severe combined immunodeficiency, SCID, DiGeorge syndrome, and Bruton agammaglobulinemia, are typically caused by genetic defects present from birth. In contrast, secondary immunodeficiencies result from external factors like infections, with HIV being a well-known example. Understanding the distinction between these causes is essential for accurate diagnosis and effective treatment. Autoimmune diseases arise when the body's immune system mistakenly targets its own tissues, a process known as the loss of self-tolerance. This breakdown in immune regulation can lead to a wide range of chronic conditions. Among the most common autoimmune diseases are systemic lupus erythematosus, which affects multiple organ systems, rheumatoid arthritis, characterized by joint inflammation, and type 1 diabetes, where the immune system attacks insulin-producing cells in the pancreas. Each of these disorders presents unique challenges in diagnosis and management, but all share the underlying issue of the immune system failing to distinguish between self and non-self. Vaccines are designed to protect us from infectious diseases, and they come in several types. Live attenuated vaccines use a weakened form of the germ, which can trigger a strong and lasting immune response. In contrast, killed or inactivated vaccines contain germs that have been rendered harmless, making them safer for certain groups. For immunocompromised patients, live attenuated vaccines may pose risks, as their weakened immune systems might not handle even the weakened germs effectively. Therefore, inactivated vaccines are generally preferred for these individuals to ensure safety while still providing protection. Let's review some of the most essential immunology facts. Major histocompatibility. Complex class 1 molecules are primarily associated with CD8 T cells, while MHC class 2 molecules interact with CD4 T cells. Immunoglobulin E, or IgE, is closely linked to allergic reactions. The complement component C3 plays a central role in the activation of the complement system. Finally, Type 4 hypersensitivity is characterized by a delayed, cell-mediated immune response. A strong grasp of immunologic pathways, mechanisms, and pattern recognition is essential for mastering high-yield immunology topics on the USMLE Step 1. Understanding these core concepts not only aids in answering exam questions, but also builds a foundation for clinical reasoning. Recognizing how immune responses are orchestrated and how to identify key patterns can make complex topics more approachable. Ultimately, this knowledge equips students to confidently tackle challenging immunology scenarios and apply their learning to real-world medical situations.